Hello and welcome everyone. My name is Dr. Komal Lalwani and I'm from Nationwide Quality of Care Network. Today, on the behalf of Nationwide Quality of Care Network, I welcome you all to today's Community of Practice session. Today's session is on role of NNF Accreditation program in improving quality of care in newborns. And the speaker for this session is Dr. Surender Bisht. Now, without waiting for a further ado, I would like to invite Dr. Sushil Srivastava to introduce the speakers for today's session. Dr. Sushil is the professor at Division of Neonatology, Department of Pediatrics, University College of Medical Sciences and Guru Tegh Bahadur Hospital, Delhi. He is the advisor for Nationwide Quality of Care Network. He is the member for National Mentoring Group NQOCN. He is also a national trainer for IMNCI, FBMC, ENCCC, DSC, NEST, POCI, and Neonatal Advanced Life Support. Over to you, sir.
Thank you, Komal, and good evening, everyone. It gives me immense pleasure to introduce Dr. Surender Bisht, who is a friend as well as a colleague and a neonatologist par excellence. He has extensive experience in neonatology and public health, especially maternal and newborn health. And today he has agreed to be a part of COP session. He has a long-term training in neonatology, received his long-term training in neonatology from AIMS in 2010-11. He has been Secretary at National Neonatology Forum 2023-24. He has been National Neonatology Forum National Treasurer from 2021-2022 and National Executive Board NNF EB member from 2019 to 2020. He has been a national convener carrying both ends of the CORD IAP FOXY perinatal module, IAP Presidential Action Plan 2022. He has been the member of IAP Standard Treatment Guidelines 2022, WHO CRO Master Trainer Quality Improvement, Technical Advisor Nationwide Quality of Care Network with us, Lakshya, MOHF, and NQOCN. He has also been a North India Zonal Coordinator and Regional Trainer for IAP and RPFGM Project, National Trainer, Facility-Based Newborn Care Program, NNF, and as well as WHO CRO Trainer for Young Infant Feeding, Counseling, and Course Director and National Trainer at IWCF Breastfeeding National Network of India, that is BPNI. So I think, Surender, it's been a great day and we are excited today. So the members of Community of Practice would learn from the NNF experience of Quality Accreditation, NNF Accreditation program, which was launched about a decade back, and what all has happened, what are the experiences, and what good things to take back and implement in terms of quality improvement and quality accreditation program. So without much delay, I request Dr. Surender to please proceed with his today's deliberations and let us learn from the best about how to go about accreditation program of neonatology units, NICU units across the country. So Surender, most welcome, and the floor is yours.
Thank you, Sushil. And I'm really indebted, and I'm thankful to Nationwide Quality of Care Network for having invited me for this Community of Practice session. This is the topic given to me was about accreditation and how it has led to some improvement in quality of newborn care. And I'm so thankful because those who started this movement, some of them are right now here. Sushil, Vikram Datta, Rahul is here, Rahul Gade, and there are nurses over here who have been part of that accreditation program. And thanks, Dr. Rajesh Mehta, sir, the WHO consultant, who have been spearheading this movement of quality improvement, and really thankful to you. Without much, I would like to share my screen. Is it fine? Should I share?
Yes.
Yes, please go ahead.
You can see my screen?
Yes, sir.
So this has been told. So, first of all, the words which Dr. Sushil ascribed were a little hyperbole. I'm not such a great expert, such a great person, and the words he was really kind of him. But I'm really passionate about accreditation. That is certainly where I would certainly want everybody to believe. So just a second, let me just put it down. So accreditation, how for the people who don't know what does accreditation mean and how it is what does it do? क्या करता है ये? It is actually based on having some optimum standards, some professional accountability, and encourages healthcare organizations to pursue some continual excellence. The government is using because of various uh, accreditation channels or you say standards which they have now done as a catalyst for accreditation of hospitals and healthcare organizations. So NQOS is one of them. Accreditation is a mean of self-regulation and peer review adopted by the institution. If I want my hospital to do fine, if I want my uh, state to do fine, I want to measure it against some norms. So this is how accreditation is done. So we can do it for ourselves also. And it is intended to strengthen and sustain the quality and integrative system, which are actually big words by themselves. And yes, certainly the processes and making it worthy of public confidence. लोगों में विश्वास कैसे जगेगा जो हमारे स्वास्थ्य सेवाएं हैं, स्वास्थ्य संस्थाएं उनके प्रति. So the healthcare systems, healthcare facilities should have that public confidence. And this is a kind of a system engineering. Accreditation is a formal attestation that a model or simulation is acceptable for use for a specific purpose. And so who gives it? So who is capable of actually doing accreditation also? So the organizations should have that capability. So where they are able to make judgment that the model which we are going to accredit, the hospital which we are going to accredit, or the person which we are going to accredit is acceptable or is of acceptable quality or standard. What are the advantages? Why should anybody get accreditation? हम तो ठीक कर रहे हैं, हम तो अच्छा काम कर रहे हैं, क्यों कराना accreditation? हम तो हमारे यहाँ सब कुछ अच्छा ही होता है. Yes, it represents it stimulates continuous improvement. So people are not complacent. They are not just sitting on their laurels. Okay? They want to improve continuously with the changing time also. And it promotes scientific validity. It provides assurance. It demonstrates accountability on the part of the healthcare provider. It provides a confidential peer review. It assures the public and to the government also. If somebody has come for inspection to my place and they said, you are not doing fine. I have on that particular day, probably my the area was not very clean, or one of the person didn't do well, and then we can so we had today we may not be performing well, but yes, we have this certificate which was actually showing that we have some defined mission objectives and we strive to meet them also. And we through this accreditation, the organization identifies its areas of strength and weaknesses, and it actually develops some mechanisms for developing its own SOPs, documents, some plans, some budgets to meet the improvement plans also. And it is a credible and independently verifiable method, because somebody else, external person is coming who is not known to you, who is not related to you, and there is no conflict of interest also, who is coming and actually judging you. How does for the for a healthcare provider, for me, person like me, it actually ensures or enhances the patient safety. So, if I want to take myself to a hospital, or if I want in my hospital, I'm aware that if I am accredited, I am providing such level of care which ensures some patient safety. It ensures some acceptable level of quality. It actually likely is to stimulate sustainable quality improvement, and it enhances the provider understanding of the continuum of care, and increases the level of esteem and status. लोग अपना लेके घूमते हैं, भाई हम तो NNF का level 3A हैं, हम NNF के level 3B हैं, and we are NNF level 2B now. We will strive to become NNF level 3A. So this is kind of a level of esteem and status which people have, and that promotes capacity building and organizational learning also. For patients and families, how does it improve? What is the advantages? It sets high quality of care and patient safety. The patient gets services by a credentialed medical staff, which has been credited by somebody else, and the rights of patient and patient satisfaction are taken care of. So this was 2022 document by WHO, World Health Organization, which healthcare accreditation quality of care. So in 2022, the role of accreditation and external evaluation. Why should anybody get it? Accreditation, because of late we are thinking that accreditation is one-time inspection. On that particular day, things becomes, you just clean up the place, you have a nice tidy room, nice tidy wards, the beds are taken clear, the bed sheets are changed, everything is done. So then why have it? Because it is not actually depicting the the kind of quality or the kind of service we provide 24 into 7 into 365 days in a year. So why do accreditation when people have doubts about it? So what were the rules? It's an external evaluation of healthcare facilities. Whatever said and done, even on a particular day on that visit, nobody can change completely. So even if they try to do some improvements, they should have some basic infrastructure. They have to have some processes in place where they can build upon them also. And the three kind of things which usually people do to check, हम अगर inspection करने कहीं जा रहे हैं, हम तीन काम करते हैं, या तो license दे देते हैं, या certify कर देते हैं, या accreditation कर देते हैं. I hope people can understand Hindi also because I'm trying to speak in Hindi in between, and which is I think Komal, which I saw the names when I thought people are from can understand Hindi.
Yes, sir, you
And
can
most
use
of
the mixed language.
Yeah, I
ठीक है.
think perfect, Surender,
हाँ,
perfect.
ठीक,
Exactly.
हाँ. So हम तीन काम करते हैं, लाइसेंसिंग, सर्टिफिकेशन, या किसी को सर्टिफाई कर दिया, ये भैया ये ठीक है, एक लाइसेंस पकड़ा दिया, जैसे हम किसी फार्मासिस्ट का लाइसेंस देते हैं, all this we do, and there is something like accreditation. Accreditation is different because it involves a systematic assessment of performance, and it is just not one point, it is clinical and organizational aspects, and that is related to some predefined standards to advise a process of continuous improvement with cycles of re-accreditation after a set period. You don't give license once and then you said, okay, license chala gaya, then इसके license की expiry 3 साल के बाद होगी, 5 साल के बाद होगी, 10 साल के बाद होगी. There is some cycles of re-accreditation which is we are keeping some set period about it. And accreditation is explicitly linked to health facility initiatives on quality of care. It focuses on hospitals, but yes, we can have our primary care providers also getting accredited. And there are accreditation which is sometimes mandatory and sometimes it is voluntary. So what is good? As of now, if we are forcing people to get Lakshya certified, it started as quasi-mandatory. It is not that all hospitals have to do it or not do it, but now because of surrogate governmental pressures, all hospitals in the districts need to have Lakshya certification or NQOCN certification. So this is something of a mandatory to quasi-mandatory kind of a accreditation of all public facilities. Sometimes like in NQOCN or Lakshya, it is done by a national or government agency, or sometimes you hire NABH or NNF, or you engage them, not hire, some private organizations to do accreditation also. And it has to be done by an independent external recurrent assessment against some quality statement. So it has to be aligned with the commitments to universal health coverage and quality. So there has to be some universal coverage of services to all. There has to be some equity in providing those services, and some essential services, quality of the essential services would be there with a people-centered approach. It is actually a lengthy and expensive and recurrent process, and that required funds to be allocated. In fact, I will show you some photographs of pictures of our NNF big hospitals, which when they are saying we don't have funds to get accredited. So especially that was not a low resource setting. So yes, it requires funds to be allocated, especially in those resource settings, to support quality improvements and the achievement of standards at target facilities. So the benefit is obviously of the accreditation, but yes, the harm is of it. It is costly and it takes a lot of time, and a lot of energy also it goes into doing one accreditation. Decision makers will need to understand how the accreditation program fits into the wider health system. So all the initiatives need to be done, and then first ensure before any hospital wants to get accredited, they should try to see whether they are able to meet the short-term goals which are there in the accreditation formats, like you are doing for NQOCN. You know what are the key performance indicators which you strive to get some of those key performance indicators and see, yes, अब हम इतना कर पा रहे हैं, तो अब हम शायद हम कर लेंगे। अब हमने फॉर्म देख लिया था, हमने फॉर्म चेक कर लिया है, और हम कुछ जो हमारे की परफॉर्मेंस इंडिकेटर हम उन्हें फुलफिल कर पा रहे हैं, तो हम शायद ही कर पाएंगे। एंड देन यू गो फॉर अ accreditation which will actually put you at a higher pedestal and label you, certify you, or given you some kind of a prize. And this is it should be not one time off, and it should be one off activity नहीं होना चाहिए, बस एक बार करा दिया उसके बाद भूल जाओ, ऐसा नहीं होना चाहिए. It be a continuous process. तो एक बार का accreditation होने के बाद you are not going to stop there. It is one of, oh, we are Lakshya certified, we are NQOCN certified, or now we are Muskan certified. No, you are not going to stop over there. You want to see that you are continuously achieving the marks or the score which you have got in that accreditation. There are 10 key points, and it should involve health workers and the public from its very inception. So they should be a part of it. Even public से हम interview लेते हैं, public से हम बात करते हैं, healthcare workers से बात करते हैं. We see how well they are participating in the whole process. So there are some. It's not only just the infrastructure or the facilities. There are a lot of processes which are going on, which actually involves active participation by the healthcare workers. So what are the tools which are there, and whether they are locally adapted or not. So that needs some kind of a standardization. So usually we develop some standards. So our standards were developed in NNF, National Radiology Forum, way back in 1989. I was so surprised to know that National Radiology Forum, which was founded in 1980 by a group of very committed, motivated newborn specialists or pediatricians or healthcare workers who were involved in care of newborns. And Safdarjung and AIMS were actually the founding places where all this activity happened in 1980. And by 1989 or 88 or 89, NNF have developed a tool to do accreditation. At that point of time, it was not available anywhere, and I don't see any accreditation standard even in US around that time. So if I'll show you the accreditation which is right now in the level 2, 3, 4 of US compared to what we are doing right now in NNF. So accreditation should be a supportive process and not a punitive one. So this is very, very important. It should support the hospitals or the healthcare facilities where we're going to do inspections, and certainly it should not lead to anybody getting punished. People-centered primary healthcare, community engagement, and health emergency preparedness and effective wider public health functions are critical to universal health coverage, and they warrant a rethink of traditional accreditation processes. So we need to change the way we are doing, and certainly all our we are doing our. NNF has actually revised its accreditation process again and again. Will come to that. I'll show you the number of TOTs we have done, and we have done the accreditation changes. And the global body of research on external evaluation or accreditation. कोई बाहर से आता है और आपको चेक करके चले जाता है एक दिन और आपको कह देता है ठीक है. उसका कोई research अब तक it's not very clear. It is still incomplete whether it really helps or not. So notably, evidence is lacking on accreditation, which Dr. Vikram Datta, the president, and Dr. Sushil just tells us at all forums also that accreditation at one point is not going to change the healthcare system, and we need to do some quality improvement. But yes, accreditation, there is an impact on healthcare workers, patients, public, and communities, and of accreditation also. And we need to learn from different countries how they've done it. So there was in this document they have from India, Uganda, Iran. A lot of country experiences have been shared in this document, which led to redesigning and implementation of accreditation program and its linkages. National Radiology Forum. So it was in historic decision in 1980 at its first national symposium at All India Institute of Medical Sciences. So what happened in somewhere in the late 70s in Bangalore, there was a conference of Indian Academy of Pediatrics in Bangalore, where the like-minded pediatricians, they sat together and said, हम एक newborn का हम newborn देखते हैं, और वहाँ पे तब infant mortality was 150 or so. IMR, infant mortality rate was 153 per thousand. आप सोचो 100 में से 15 बच्चे मर जाते थे. So it's somewhere around that. That was the level of kind of number of deaths which are occurring, and almost 80-90% were 70-80% were all newborns only. That was the kind of deaths. आप सोचेंगे 120, 130 per thousand was a newborn, maybe the newborn mortality rate at that time. So they were very committed, motivated pediatricians who sat there. And in 1980, at first national symposium happened at All India Institute of Medical Sciences, and they had this simple message: get the newborn its due place and rights. Do whatever you can. We are with you. So this is an article, review article, published in 2009 by Santosh Bhargava, who was the founding father, Harish Shalani, and J.P. Satish. Dr. Ramji, Siddharth Ramji, our past president, has written this 50 years of neonatology in India, and where he is dedicating it to the newborn health care research, care advancement and management, and role of NNF and its leaders out there. Accreditation started somewhere, as I told you earlier also. It's somewhere around 89 to 90, and probably, I have Lady Hardinge Medical College was the first center which was accredited by NNF for level 2 year in the year of 1991. This was level 2, and we have our first level 3. That was the Malankara Orthodox Syrian Church Medical College, and now we'll see how. So, even in 1991, and you look at the kind of enthusiasm and and you say interest of the NNF members or the pediatricians of this country, that in the second year only, 51 hospitals or medical colleges or healthcare facilities got accredited, and that the kind of speed it should have then fell down over the time, and there were reasons, and NNF was not such a big organization at that time, and the initial enthusiasm, initial activism didn't keep pace, and many of those who were accredited were always considered accredited only. So I don't think there was a good process of re-accreditation, repeated accreditation at that point of time. These were the new entries which came. So by some time these were the accredited numbers, almost 56, 61 now. So they were in different years were getting accredited, and 83. So by 2006, which was Malankara Orthodox Syrian Church here. Let me use my laser. You can see. So Malankara Orthodox Syrian Church Medical Mission was one of those hospitals. And this is the kind of accreditation. I'm just taking you through the gallery of photographs which I could access from the NNF our storerooms. And this was the way the secretaries and presidents were actually making those lists, typed cyclocell types. And then came the time when some computers came probably. And this is the hospital which were getting accredited that time. I think email started around that time. And this is the number of hospitals which got accredited around this. And look at the letters which went through our secretary, like Dr. J.P. Satish in 2003. He's saying you have got accreditation of level 2 sent to Neelam Clear from SSKM Hospital, and the handwritten note of Dr. A.K. Datta, where he's actually telling somebody, and he's had this kind of a note by the president, and he has visited this hospital, and he says, I'm impressed with the attitude and keenness of the entire staff of the nursery to learn. With limited budget, this nursery is an example to be emulated and simulated, I think, at the other part. So this is the kind of thing which he did, and I'll just take you about this. And I think this happened. I'm just taking you about this. So some of the hospital, Dr. Anil Lara wanted to tell that we are doing inspections now. This is the time we have to look at it. And by 2006 or so, there was a need that our accreditation criteria needs to be changed, and he gave the summary. This should be the mandatory criteria. This is the way it has to go on, and he wrote it to the secretary over there. So there is a thought process, and there are our forefathers, our Daans of National Meteorology Forum were continuously looking into it, and they were way ahead than other countries or other accreditation process. So what should be the mandatory criteria? What should be the adequacy of trained manpower? What should be medical? All that was being done in that part of. And this is how the committees were formed and done. I'll just take you. This is a very small hospital, Dr. Sant Dhaneshwar Hospital in Pune. I just visited last year, and I realized it's a very small hospital in Pune, in the middle of the market, and that got accredited in 2005. And it's not a medical college. Imagine the momentum which NNF picked up, and when there was no government sanction to it, there was no it was just कि लोगों की इच्छा थी अपने आप को improve करने की. There was a desire to come up to that level कि हम NNF में NNF के level पे आएंगे, हम NNF पे level 2 लेंगे. And it was a very small center which I visited just this year also again. These were the letters in 1993 which was being done, and just take you this. And this is the form. Look at the 1990. How does the form look like? So एक typed form जाता था, लोग उसको form भरते थे, yes लिखते थे. It used to come, and then somebody used to go and verify them. This is from CMC Vellore. They are asking for accreditation. Look at the institution, and they are filling the form, and these red marks are where the assessors are having copy doubts, and they're looking into it, and they are going to it, and they are making comments about it. So this was the form which was in 1990. And over the time, I know I've just jumped from 1990 to 2012, around 12 years or 10 or 12 years of more than that, in fact, gap. And then came the time when the criteria which was suggested by Dr. Narang and all that were now incorporated, and a new form was formed. And this is around 2012 or so. And here I know there is one of the Vikram Datta is not here right now, but he's very instrumental in making this form over there. And Dr. Rahul Gade, who is there today, he has worked. Thanks, Rahul, for actually making such a good document. You will be surprised. No other form in the world, if you, I don't know, because I've जो भी आप Google search करें accreditation criteria के लिए, NNF से ज़्यादा open, transparent, accessible document is not available. There are accreditation standards in some places, like in Europe, in UK or US, but वो उनके आप form नहीं खोल सकते हो, आप उनके standard नहीं देख सकते हो, and I don't know how the form looks like, because it is paid. You pay and then only you get that form. But the standards, I will show you what the standards are there, which was published in Pediatrics. So this is the form which was done, and total NNF accredited right now are around 297, out of which level 2A accredited centers are 53, which now we are not doing anymore because the government is actually doing SNCUs. Level 2A were SNCUs level accreditation. We were doing those accreditation when nobody else was doing. Government was not there to do any kind of accreditation. They have started their SNCU accreditation in just 2 to 3 years back only as a part of Muskan, or you can say with NQOCN, SNCUs were being looked after around 8-9 years back also. So a number of level 2B accredited centers which are core strength, which are providing quality of care services, including invasive ventilation service care to sick newborns. That is our strength, which is actually trying to provide quality of neonatal care to sick babies across India. And our level 3 accredited centers are 78, which is high quality centers which are providing cardiology and pediatric surgery and cardiac surgeries, cardiologic services. And 3B are where cardiac surgeries are also being done. So there are no referrals from these centers. And we did, after 2012, when we revised this form, and after that we have done our repeated accreditation duties, we realized that accreditation will require training of the assessors again and again, training of the change in standards, because how the standards have changed over time, how the processes have changed over time. So over the time, we have done multiple accreditation trainings, and this is most of the time, this is with almost all the time, this is with support of the UNICEF, except the last one. The government of India at that point of time, still very recently also, relied heavily on National Oncology Forum for accreditations of SNCUs in Madhya Pradesh, 2013 and 14. And I think Dr. Vikram Datta played a very crucial role in getting this done. Accreditation and mentoring visits of in Bihar in 2014-15, then Odisha, Rajasthan, Karnataka, AP, Telangana, Andhra Pradesh, and till very recently we are doing it. And we have been approached by government again and again to help them in Muskan certification also. And these are the standards which American Academy of Pediatrics have. So you look at those standards which are published in pediatrics. This is the simple one for what should be for a level 1 institution. कुछ साल के लिए चलना चाहिए, 3 साल के लिए चल रहा हो कोई neonatal services, और वहाँ का program का कुछ description होना चाहिए at the time of neonatal verification. This is all what you need to know about them. So, I think a laser pointer. I'm trying to have some laser pointer. Can you see my arrows?
Yes, sir.
Neonatal program. You can see my
Yeah, they are visible. Yeah, they are visible.
So, neonatal program. This is a level 2-1. Again, very few of them. I'll show you my form later. And this is the level 3 form, which looks like a crowded 1 pager or 2 of the level 3. And there's 4 or 5 for level 4 all there. So let me give you a glimpse of our level 3A form, which we have made recently in 2022. We have revised it also. And this is the form, which has some note for how it is to be filled. And this is to be filled by the unit which wants to get. So this is available to them. It is easily available, freely available to anybody to look at. So we have been transparent. We have been providing this form across the globe to anybody who wants to use it to improve their services. So this is the strength of NNF. We have not kept it under wraps, and we don't want to hide it from others. We have made it available for anybody to use. Anybody can adopt it in their centers also. So, and there are some mandatory elements, there are essential elements, and so there are some desirable elements. So here we say, so there is a self-application form and self-assessment form is to be completed by applicant at the time of applying. So they know what an assessor is going to look into that center, and they are going to write everything. What are the mandatory elements which have to be met compulsorily by all newborn care units which want to get accredited. And if they fall short of mandatory criteria, it should try and rectify something, then reassess. There are essential elements in each section. These essential elements are to be marked 1 for yes and 0 for no. And total marks will be compiled at the end, and you have to see that there are some desirable things which are non-scoring. So if you have it, that is fine, but not that we are going to give you extra mark for this. Only scores from essential elements would be used for scoring, and this scores will be used by the assessors along with on-site assessment of unit to arrive at the recommendation for the unit. The final is being done by this, and 75% of the sum total of all essential elements, the score should be 75% essential. This is how they fill the form. This is something, and you give available number of beds in the unit, minimum 24. For level 3A, now we want that the minimum number should be 24, out of which level 1 should be 12. 6 should be at least 6 should be level 2A, and at least 2 should be of advanced ventilation if they are going. So unit should have been accredited as level 2B for at least years. So this is what we wanted, and we want that this should be the number of beds which are there. And what should be the number of junior doctors, number of nurses, total deliveries, and there has to be some critical infrastructure and some critical threshold hospital staff to provide healthcare services. And what if they are doing any for level 3, if they are doing any other teaching training programs like DCH, DNB, DM, whatever it is. And this is how we are actually now. We have refined it much in detail, and we have want to know how the unit is performing, so that unit knows what it will be assessed, and they are going to dissect their data in these categories. And there are services, and these are the 12 services which will be done: housekeeping, ambulance, autoclaving, laundry, kitchen services, information technology, facility management, BMW, pharmacy, security, supply chain. This will be checked. And this is when we look at the registration. And as WHO also said, because all this accreditation has some legal connotations, or you can legal implications also. So if you are accrediting any body, is accrediting anybody, somehow it is binding of them that they see that they accredit the unit which is following the law of the land, which is following the licensing registrations for various hospital services. So there has to be, it should be under the Clinical Establishment Act, which has recently been done, and it should be registered with the local authorities. There has to be building occupancy, should not be temporary. आज एक नर्सिंग बनाई और काम कर दिया, यहाँ से शुरू कर दिया, इसको accredit करा, ऐसा नहीं चलेगा. They have to, it has to be occupied, and there has to be completion certificate for that. Fire department का NOC बहुत जरूरी है. Drug licensing, these are all very, very essential. They have to have this, otherwise they should procure all these kind of certification and licensing, whether it is PNDT Act registration or pharmacy, AERB, atomic energy for X-rays, research board approval for X-rays. And these are the services, like services of care, which is like services, and there are mandatory element and desirable element, which are there, and mandatory, essential, and desirable, which are there. Infrastructure, this was, we have said at least minimum 4 beds. This is, I'm just showing you the form, so I'll not tell you all this, because these are so many points. Almost you look at the 17 points we want, in fact more than 17, and mandatory point in the infrastructure. Itni light honi chahiye, itna 24/7. These are mandatory. ये तो होना ही होना चाहिए. Supply and logistic for the portable X-ray facility होनी चाहिए. Blood bank component का कुछ सब, because you are giving them level 3A, so they should have a blood bank with component therapy. Uninterrupted availability of blood power supply होना चाहिए. Facility of dimming होना चाहिए. Essential is, yes, if they are level 3A and इसका 75% तक score हो सकता है, तो उनके पास central compressed air line होनी चाहिए, separate collection of water होना चाहिए, MRI CT होना चाहिए, contingency space होना चाहिए, and power audit होना चाहिए. इनमें से almost you can see 75% चाहिए. And desirable is if they have a system for air changing in NICU. And similarly for equipment, these are the essential list of equipment mandatory list of equipment which they are need to have to get actually apply for certification also, accreditation also. And this is something which is essential. In unit ABG है नहीं है, but ABG होना चाहिए, mandatory है. हॉस्पिटल में या विद इन हॉस्पिटल प्रेमिसेस होना चाहिए. अगर आपके नर्सरी के अंदर ही हो जाए तो वो एसेंशियल में डाल दीजिए. टीपीसी रजिस्ट्रेटर यहाँ पे है, कुछ चीजें यहाँ पे कंबाइन, कुछ मैंडेटरी और एसेंशियल्स में ओवरलैप कर रहा होगा. So portable electronic weighing scale with minimum 5 grams sensitivity for each area. At least 6 neonatal ventilators, including 2 advanced ventilators in a level 3. Something like this has to be there. And this is about the human resource, where we are actually talking about कि कितने एक पार्ट टाइम कोई कंसल्टेंट आके भाई मैं इस हॉस्पिटल में भी जा रहा हूँ और मैं 3 हॉस्पिटल जाता हूँ और वहां से कर रहा है तो नहीं चलेगा. So this is not something which we agree, and we will not certify. We have not given accreditation quite recently also. So they have applied, they got the inspection done, but then we realized, yes, they had written one full time, but there was not a full time consultant. So we said, you please have one full time senior consultant, so with 8 year experience in neonatology, and who is not attached to any other full time to any other hospital. 2 senior residents or junior consultant with 3 years experience on floor, 1 resident doctor. So this is the kind of, ये पूरा करने के लिए अच्छे medical college, अच्छे hospitals are struggling. But, and we have around, I showed you around 78 of level 3A. So this is the number of strength NNF has across the country. We have 78 of level 3A services which are there. And and there are 13 level to be. So these services which many of the even medical colleges were saying, "Ye to hum kar hi nahi sakte," and this is not the kind of services which we can provide. And the nursing, in fact, कितना nursing होना चाहिए, BSc कितने साल का होना चाहिए, कितने training होना चाहिए, और ratio कितना होना चाहिए. This is what we have said. And the best of, and mind you, 297 got accredited. So they had this, and now 157 or 78, around 200 of them are actively being followed up also. They are under our radar, they are under our care, they are under our lens again and again. This is a laboratory things which should be available, banded, also oximetry with signal extraction technology. This should be available. So we are actually asking state-of-art infrastructure, state-of-art machines, and which are available now. And it is not that it is not possible for many hospitals to get such kind of a facility. They are having the processes, how the processes were being done, whether the instructions were there, the protocol, what laboratory investigations were beating, what was the transport has been emphasized so heavily, in our accreditation criteria. So even in transport, the baby need to be provided with warmth, oxygenation, suction, resuscitation kit in the ambulance. There has to be a transport incubator available with the unit for use during transport of the baby, and availability of neonatal nursing staff or trained doctor in all transport, and transport ventilator in the ambulance. If you are having a level 3A, and neonatal transport ambulance of a size of a tempo traveler, we have even that we have asked, and we see that this is being complied. Case how the case records are maintained. In fact, Dr. Vikram Datta and Rahul and Ankur and Dr. Rajesh Mehta sir has actually done some quality improvement, has suggested, which have been incorporated recently also. And this is the academic form which was being done, so that the teachers and the consultants who are there are not those who are just doing some private practice and they don't know anything about what this is new in the world, what are the new research, what are the papers which being presented, whether they attend workshops, because you're granting fellowship for the young fellows to get trained and the nurses to get trained over there. So they are under care of a teacher who is updated with the knowledge. And this is the QI elements which mandatorily in level 3A should be done, and there are some desirable also. Like there has to be some mission, vision, and quality of objectives clearly communicated to staff. The facility uses methods, and I think Sushil, Rajesh Mehta sir, Rahul, Ankur, who are right now sitting, they have made and they have kind of done some, say, a lot of discussions, and that has gone into actually deriving these criteria. Now we are using this for level 2A में कितना होना चाहिए, कौन से level care पे कैसे आना चाहिए, mandatory बढ़ाया level 3. So how do we do accreditation? So we have shown you the journey of accreditation in NNF so far, and the number. So the hospital applies for accreditation, जैसे अपना form भरते हैं, वो central office आता है. Within 3 months of the NNF, we assign some assessors for the hospital, and we ensure that the assessors are not from the same state, not even the city. We are ensure that कोई conflict of interest नहीं होगा, ये नहीं आके जाके accredit कर ऐसे ही चलेगा. So we usually have it from 2 different states, not even 2 same state also, an on-site facility visit by assessor, and then a recommendation report is reviewed by accreditation committee, and within 4 weeks feedback was to be given. But it usually within 4 weeks nahi ho pata tha. So you see, we did some quality improvement. Thanks. I think Dr. Vikram suggested that we should do such a quality improvement here, and we did this kind of quality improvement since January when I took over as the secretary. That time duration from assessment to accreditation approval decision. कब हमें फॉर्म मिलता था, कब हम assessor जाता था. अभी आप फॉर्म जब मिल रहा है और assessor जब उसमें अभी भी बहुत टाइम लग रहा है, 2-3 महीने का, कई बार 4 महीने का टाइम लग रहा है. But yes, the time from assessment to actually telling them whether they are approved or not approved, what is the decision, whether they have to do some rectification, modification, has now significantly decreased to almost like 4 weeks or so, 4 to 5 weeks. And we have now, NNF has gone ahead, and now we want to move with the app. So the accreditation form जो पहले हाथ से भरते थे और जाता था, फिर form भर के आते थे, ऐसे से भरते थे. Now we have developed a accreditation app. That beta testing has been done, and now the form gets filled up. There's an app which the assessors go, and it is यू कैन से वो उस वक्त उसी समय पे वही हो रहा है, तो ऑन साइट हो रहा है, तो उसके आप लॉन्गिट्यूड लैटिट्यूड आप ले रहे हैं, जीपीएस लोकेशन से काम कर रहे हैं, तो इट इज, तो कोई उसमें मेडलिंग नहीं कर सकता है. तो फॉर्म हैज टू बी फिल्ड एट दैट टाइम ओनली एंड इट विल बी सबमिटेड around that time only. So this is this is not a video which is right here, but yes, this is the kind of app which is there, and there एक एक करके आप कॉलम खोलते रहते हैं, फॉर्म भरते हैं, और उसी लैटिट्यूड लॉन्गिट्यूड पे आप काम कर रहे होते हैं, एंड यू क्लिक रियल टाइम फोटोग्राफ, real, and you do the licenses, certification, everything is being clicked at that point of time. So that is the kind of app we have developed right now, and I think that is all with this I wanted to tell. Thank you.
So
I hope I have not taken
no,
more
no,
time.
no. I
Some
think
point.
Dr. Surender, it was a perfect summary. In fact, such a vast history of NNF. It has been, we were in fact quite mesmerized going through the whole journey. And I can see that among the participants today,
You
we
have done
have
it.
Dr.
It's not
Vikram,
me.
Dr. Rajesh Mehta, even Dr. Rajesh. Yeah. Yeah, no, it's okay. It's all the team. In fact, I'm feeling so proud and so you can say excited by the journey which you showed from 1980, 89, and so far we have come. I think it's a proud moment for all of us, including the present team, the secretary, president, who have been doing a wonderful job. So I will request Dr. Vikram to give his comments, and then I'm excited to see Dr. Rajesh Khanna too, from WHO CRO, and Dr. Rajesh Mehta is also joined. Welcome, sirs. We'll be taking their comments and their suggestions too. Dr. Vikram, your comments, please, and then we'll be going for the question answer sessions. And some of the questions who have some doubts or want some queries, they've already posted on question answer panel. You can put it more, and we'll be taking it in the last. So, Dr. Vikram, any comments from your side?
Thank you so much, Sushil. In fact, excellent presentation as always from Dr. Bisht, Secretary, National Neonatology Forum. On behalf of NQOCN India, I would like to thank NNF as an organization for standing always in times of need and complementing the movement towards quality improvement and quality assurance. NNF being the parent body for all of us who have now been, consistently working for the movement of quality improvement in India. The journey makes us very, very nostalgic. It has been a difficult journey and very beautifully covered. In fact, Dr. Bisht, some of the papers which you saw, you digged out of NNF archives. I think most of the senior NNF members also would not be privy to them, including the ones from our founding fathers at the National Neonatology Forum. Thank you so much for sharing them and giving us a feel of the rich legacy and the heritage which this great organization has. At this point of time, I would just like to mention briefly a couple of points regarding how the genesis of the revised accreditation program came when it was the year 2012 when I was the Joint Secretary NNF. I think that was the time that Professor M.K.C. Nair was the president, and that was the time then it was felt that NNF had a beautiful legacy, and this program had initially been conceptualized. And as Dr. Surender had shown, multiple units were done, and there were standards which were in place, guidelines which were in place. And for the last nearly a decade, not much momentum had been on that because there were different programs into which NNF had got involved. So even despite having a beautiful, phenomenal program and the guidelines which were made by the founding fathers of NNF, our attention was, into the district newborn care program and a very beautiful program, which was a facility-based newborn care program, which Government of India has now conceptualized as a national program. And it's mainly NNF's program, which has now gone into the FBNC program. A lot of neonatal units were formed in the country between the period 2007 to 2012-13. And that was a time when it was realized that the mushrooming of the units not only happened in the public sector, but also in the private sector. It was felt that most of these units need to adhere to a basic minimum standard of care. And that was the time when it was realized by the expert group which was constituted in 2013 to revise and relook at this accreditation program to introduce the element of adherence to the processes of care. Before that, in the original program, there was not much emphasis on the processes of care. And I very honestly admit that being Secretary NNF in 2013-14, I had heard the word processes of care for the first time in that meeting. I was not aware what is processes of care. And that was a time, you see, nearly 11 years back, that NNF started looking at the processes of care. Separate mandatory elements related to processes of care were inbuilt, and the criteria for level 3A and 3B, including the criteria for level 1A and 1B, etc., were inbuilt. I would like to mention here that in 2014, NNF had the rare distinction of accrediting over 165 neonatal units. And most of them were from Madhya Pradesh. 43 units were from Madhya Pradesh, the government facilities. And this was recognized as the first BMJ, awards. And then NF was recognized for quality improvement in healthcare in the final 3. And that was the time the entire program was presented to global audience. And since then, there has been no looking forward, backwards. Subsequent office bearer teams, including the present office bearer team, I think they have again, tried to look at and add the elements of quality improvement. And I, without any doubt, say that linking this program to the accreditation and the fellowship program together, along with in building an element of quality improvement, makes this as one of the most beautiful tools which is available for improving the quality of care of neonatal healthcare services in India. So I would urge all the participants to, widely disseminate knowledge about this tool, take training, be a part of the accreditation team, and also to learn about quality improvement methodology, which is a journey towards assurance, and the improvement and the assurance both being complementary will help in improving the quality of care and reducing the neonatal mortality of our country. So I'm sorry for being, slightly elaborate, but this is how the entire process evolved, very aptly picked up by Surender. And over to
thank
you.
Vikram. Thank you, Vikram. In fact, before you joined, I was telling Rahul that there was 2012 is the time. You can say NNF had before 2012 and after 2012. So there is a BC and AD type movement. It's a watershed movement. That kind of a movement which happened in 2012, which actually catapulted NNF to a different orbit altogether.
Sushil, over to you. Thank you so much, Surender.
Yeah.
Thank you.
Thanks, Vikram and Surender, again bringing the nostalgia and sharing with us some very important key points of accreditation history with NNF. I will request Dr. Rajesh Mehta, who has been a great friend and mentor as well as a guide for all of us at neonatal fraternity, helping us in quality accreditation, quality improvement, whether it is NNF, whether it is NQOCN, wherever you are. His expertise and insights are always you can say a guidance and as a beacon of, you can say, ray of light, which helps us to progress or improve our speed or pace. So Dr. Rajesh Mehta, sir, your comments, and then I'll be requesting Dr. Rajesh Khanna, who is the present WHO CRO chief, to have his comments and his inputs, and then we'll go to questions quickly. Dr. Rajesh Mehta, sir.
Apologies for a poor connection. I'm out traveling. And Surendra, great job to set out this, the history and the advancement, the progressive nature of this process which NNF has led. You are right. NNF was the one who is instrumental not only in India, but globally also. These experts have led to newborn care being, promoted as a public health priority. And accreditation leading to quality of care, everyone has said it is a stepping stone, and one-off is never useful, is less useful. So you have to continue to see your standards. and also constantly improve, as Vikram was highlighting, that continuous quality improvement could follow, and then you provide all the time, every time, the right care at the right time and every time. So, but you look at another aspect. Now, Ayushman Bharat is any cost. So, are we paying attention to those units which can be impaneled, which may be private, which may be government, mostly private, which already are receiving attention? So, can we go down to level B cities or level C cities where Ayushman Bharat beneficiaries would be there? So maybe some version of accreditation so that people can be ensured of good quality of care. Secondly, have we done enough, Surinder, and you are a current secretary and other office bearers of NNF. How much public does recognize NNF? And how much, a NNF accredited private hospital would attract more patients than others? Is there a value addition in addition to the internal satisfaction of people who are owning that facility and are happy to have an accreditation? Of course, this is great that we are very conscious from our side. But what is the value addition? Are the people looking for such units to go and take treatments? So we have to do a little bit of more awareness that NNF is as an entity, and then how are we helping the people to receive the best care? But a lot of thing has been done, so more to come and more to take forward. Thank you so much for this webinar, NQOCN team. Excellent opportunity for people to learn and understand how it has progressed over the years. Thank you. Over.
Thank you, sir.
Thank you, sir.
Sir, let me respond to you. The 2 points which you added were about Ayushman Bharat. So it's very heartening to know that many of our NNF accredited units across India are actually taking the advantage of Ayushman Bharat in many states. Not in all states, not the big corporate hospital, but yes, the second tier cities where NNF accredited centers are there, they are providing care to Ayushman Bharat, and I have visited a few of them, and we have realized that the same kind of care is being provided to a private patient and to an Ayushman Bharat patient who is being admitted in their place. So we have seen that. I have seen it personally also. The other question was, sir, the other comment was about what is the value addition to the unit, or whether the people get attracted or not. Sir, it certainly gives the unit the confidence to come up and actually stand up to that level that we are an NNF level 2B or 3A accredited centers, and we have been validated by excellent agencies. So since the validation which is there as of now is only NABH for the whole hospital, not for an ICU level thing, for a private facility, NNF is the only validating agency which validates them to a level of quality which they are providing. There may be one or two now or more, but I think NNF is the only one. And for that, and apart from this, the other value which the unit gets is they get to train fellows. The fellows get attracted to units which get accredited, and the fellows across. This is how the newborn care has branched from big cities to district level or smaller cities to tier 2 and 3 cities now also, where the young resident doctors or the young doctors, they get exposed to level 2, level 3 care in these accredited units, and there by their exit exams they get qualified, and then they go back to their district hospital and state hospital, and there they are actually providing a good level of level 2 care to babies, and babies are being saved across the country by these services. So there is a value to NNF by people actually want to get themselves accredited. Sushil.
Thank you, Dr. Surender. A very pertinent information and very keen, you can say, points made by Dr. Rajesh Mehta. Now I will request Dr. Rajesh Khanna, who is the President WHO CRO, to kindly give his comments before we go to some very interesting questions which we have. We are slightly prolonging our session, but I think it's very, very important. And I hope Dr. Surender will allow us to go with these questions. So Dr. Rajesh Khanna, please, sir, your comments, and then we go to question answer session.
Okay, thank you. Thank you so much, Dr. Sushil, and very nice to see Dr. Bisht and, of course, Dr. Mehta, Dr. Datta. First of all, apologies that I was stuck somewhere, and despite my best attempt, could not join on time. But what I hear from the last few things, that it seems to be a very interesting journey of NNF. I think Dr. Mehta has brought on a very important point, but I'll just like to take it a little bit ahead. I think it's very important that we have a journey, and we are seeing accreditation as a process to see how it is contributing to improved quality. But have we created some evidence about it? Have we compared those units with the relative other units? And what is the difference that we are seeing? Probably in terms of the outcomes of care. I think that is a small thing which NNF can start doing it. Just to see that, of course, we know it definitely leads to improved health outcomes, more lives being saved, less morbidity, but can we bring it in terms of hardcore evidence? If that is there, and that will be comparison with the other units which have not been accredited so far. If that can be brought in, or before after study, what was the scenario earlier on and what happens after accreditation, that will really be helpful. But look forward to, I will probably get to know more about this study when I see the recording, but happy to contribute more to this movement. And congratulations once again, Dr. Bisht, and the entire team which has been working relentlessly over the past 10 to 12 years to ensure that this journey continues and gives results to improve the outcomes of the newborns in the country. Thank you.
Thank you, sir. Thank you for pointing us to get that evidence which is out there or documented and showing.
Sushil, so Dr. Rajesh, thanks for putting up. And in fact, this is what we were thinking about it. This is what we are discussing also. And now with this app also, and we have the data. We collect data here, accreditation all the time. And we are getting the mortality statistics of all those units. Now we want to, you rightly said, now we do accreditation every 3 years. So we have at 3 points, we have data of all the units which we are doing. And we know how they are improving over time. This is what we wanted to do, that kind of a data analysis, and we need some support. We were actually about to come to some places and some funders to do that also. And this is what we are doing. And in fact, for prospective nature of a study, this app, if incorporated, will automatically, and we are doing now, we'll ask for annual data also from our units, and we can have we are devising some data points, not the extensive data points, but some data points about some hospital infections, some jaundice, some major common conditions, major admission criteria, what is the birth load and all that. Some points which Dr. Praveen Kumar has already made, and we are just about to roll that also. And where we will follow those units, and we will have a real-time kind of a data collection from all our unit through this app and through this data points also. So this is something which is in mind, and you rightly, when the idea germinates, it germinates at so many minds, and its time has really come now. I think this idea will be implemented soon.
Thank you, Dr. Surender, for highlighting how the NNF is now going to bring out some evidence which is already out there. I can also see Dr. Ankur Sood, an advisor to NQOCN, and also a great quality improvement champ. We have learned from him, and he has been not only in India, but across Southeast Asian countries too, doing a wonderful job. Dr. Ankur, what are your inputs and observations regarding accreditation program, quality improvement, and how its impact can be further amplified and help our healthcare services, especially in neonatal maternal area. Dr. Ankur, please.
Yeah, thank you, Dr. Sushil, and thank you, Dr. Surender, for the wonderful presentation. I mean, I got to learn a lot about the genesis of NNF's accreditation program today. I've learned about it since about a decade, but I didn't know that the roots were, much longer. So I think each one of us panelists has been giving you ideas to how to take this further, and I would not do anything much different. Accreditation programs, just to take it to the next level, accreditation programs can also do QA, that is quality accreditation or assurance, and QI. In some way, I see the program has evolved over years and decades, right? But in the truest sense of quality improvement, there has to be deliberate stopping, reflecting, and iterating, right? I hope you would agree with me that many times, you have evolved because the need was felt. Evolution can be faster by iterative testing. You understand quality improvement. So the evolution of a quality assurance program can also be faster if there is deliberate learning, right? Particularly for someone like you who is at the helm of affairs in NNF for so long, it will be good to continue to reflect every year. Probably in those cycles, continue to iterate and make this better. So you could do quality improvement for the accreditation program. You could also do quality assurance for the accreditation program. Accreditation programs are also accredited by third-party agencies, and that gives them international validity. That also brings in a lot of things like you're able to brand them, you're able to sell them to payers, Ayushman Bharat being a case, right? It makes your case easy. I mean, you probably, many of you would be aware that certain accreditations fetch you a better rate from the insurers, right? But that rate could get better, and if your accreditation program itself is accredited by a third-party agency. So frequent measurement of the program itself and frequent reflection will help you keep getting better. Those are some of the thoughts, and I'm sure you're not going to be able to take up all of these things immediately, but then those who do good are told to do better, and that is the feedback. Thank you.
Thank you. You are our QI mentor who actually taught us QI in 2014 and 15 in my hospital also. And as I was trying to make that graph, that the time taken, time of duration from the assessment to the decision by the committee, and the committee actually is now brainstorming all. So it is not like one person taking a decision, kisko approve kar do, nahi kar do. Now the forms get properly dissected. The assessment में कुछ भी लिखा हो, but the forms get properly dissected by the accreditation committee of a very high profile members across the country, which meet every 2 weeks. And despite that, we are able to give them approvals and decisions, whether any corrections need to be done within 4 weeks also. Within sometimes 2. Now this time we could give them 3 weeks also.
Thank you, Dr. Surender. And now we will take the much awaited questions. Dr. Surender, I can see there are some questions, especially from our pediatricians and neonatologists who are working in public sector hospitals, government hospitals. They have very, very pertinent questions for NNF. They want to know, first of all, can they get this toolkit of your accreditation for self-assessment? How? One. Second, is it possible that government institutions can also apply for accreditation program, whether they have to involve the government directly, and what about the financial charges and how to go about it? So these are very relevant questions. I've clubbed them together so that you can take it for the benefit of your question people. Otherwise, some specific questions also will take. Dr. Surender.
So Sushil, so I think Dr. Rajesh Mehta touched something of that thing, okay. And I wanted to seek support. So in past, as Dr. Vikram said in his tenure when he was the secretary, MP government took help and support of and used this tool to accredit their SNCUs, and that brought about a sea change in the kind of SNCUs which were available at that point, even in Haryana, Rajasthan, MP, Telangana, everywhere. So NNF tool was used. across the country. And now somehow, because of whatever reason, the government wanted to have its own, and I'm good that government should have its own tool. But the rollout is not to that level, and probably that has hindered because the UNICEF, which was supporting us, has said no, now we'll support the government tool to accredit SNCUs. That has stopped the process completely, and now you have SNCUs which are being accredited by some way, and this is a tool which is being done, and it is a tool where uh, somehow NNF is a partner in Muskan also, and SNCUs in even in Lakshya also. So we are partner to that, and we want to prove in that way also. So, but how NNF role should be there, that government has to put, because there is a big 10,000 strong member body across country available to support this accreditation process, which the government and the funding agencies should kind of advocate for this. The other question was whether the other was about medical colleges. The problem is with medical colleges. SNC उसका तो तब भी कर लिया लोगों ने. What happens to the क्योंकि जो criteria है वो मुस्कान में उसमें है ही नहीं. वो level 3A, level 3B का जो आना है medical college के लिए, and all medical colleges, आप मेडिकल कॉलेज बना रहे हैं, उनको लेवल 3 नहीं कर सकते हैं, तो फिर आप क्या रेजिडेंट डॉक्टर्स को पढ़ाएंगे? क्या रेजिडेंट डॉक्टर बाहर जाके ट्रीट करेगा? अगर उसने कभी देखा ही नहीं होगा वेंटिलेशन में क्या प्रोसेसेस, क्या मैनेजमेंट करते हैं, क्या इंफ्रास्ट्रक्चर होना चाहिए अगर आप किसी को वेंटिलेट कर रहे हैं, सेंट्रल लाइन डाल रहे हैं, क्या क्या क्लास फी देख रहे हैं, अगर उसको नहीं पता है तो हाउ दे आर गोइंग टू डू इट? एंड दिस इज अ बिग लैकुना व्हिच द गवर्नमेंट डजंट वांट टू एड्रेस एट ऑल. Sorry to say, sir, both Dr. Rajesh Khanna and Dr. Mehta is here, but I think this is somewhere where NNF only can do it, and there the state medical education board or the state governments should actually involve NNF in getting their medical colleges accredited by with level 3A or level 3B toolkits. Where it is available, it is freely available on our website nnfi.org. You go there, in the downloads you can find the accreditation tools. Anybody can access them right now. Or if somebody, I don't have my people, otherwise we can give you the link of the accreditation tool also.
So Surender, like Ankur said, it's good time to come onto the table with the new tools, review and reinvent your role, because NNF has always been the advanced leadership. Government only follows. So you continue the journey, take it to the next step. Funding, we can see whether this can be self-supported. But first thing is to come back to the drawing board and see you are still relevant for private sector. You are still relevant for medical colleges. So all of that is important to continue the journey.
Sir,
thank you.
Sir, as far as private medical colleges are concerned or private hospitals are concerned, so their NNF accreditation level 3A, 2B are being done. But the problem is with medical colleges, and there they are not following the SNCU criteria. They are not getting Lakshya certified also. They are not doing Muskan certification also that level. But they are supposed to provide high level of advanced.
I agree. So let's find out. Since you said mandatory may not be possible all the time, we'll have to find champions.
But funding is required. Funding is required from funders. In fact,
तो पहले एक अच्छा सा डिस्कशन करो, सब लोग मिलके प्लान बनाओ, फिर देखते हैं फंडिंग का क्या है. ठीक है? So let's design something which can be value addition. So right, I think a lot of activities, a lot of work to look for. Dr. Surender, there is another question. One of our participants wants to know how they can attend your TOT for new NNF accreditation and assessment program. Are these program TOTs being available, and how they can access that?
So yeah, so if you're interested in TOT, we did it in 2022 only, twice, because we were falling short of our SSS also. We have already made around 100 SSS last year, new SSS, because the old one made long time back in 2016 and 14, 16 and now 22. So we have done 3 level of TOTs, and we know that to actually do a lot of assessments and to apprise even the old SSS, the new standards, the new processes, the new way of quality improvement. We need to do that re-accreditation TOTs also, and we need support. And for this, I will certainly ask Dr. Rajesh Khanna and Dr. Rajesh Mehta that we need support for that to conduct those TOTs so that our accreditors, our assessors are of our quality to objectively accredit or assess the units. We will do that. Yeah, good. Somebody, Shajan, thank you. Shajan is a new assessor. He was made assessor this last November only, and he is now he's done an assessment also. Shajan, thank you. Shajan is working in Rainbow.
You're on mute.
Shajan is working in Rainbow, Delhi.
Sir, you are on mute. Sushil, sir.
Sorry. Yeah, my bad. So, Dr. Surender, very important point made by you, especially for the your medical colleges, public sector medical colleges. We are actually stuck up between Muskan, Lakshya, and then the NNF accreditation guidelines. Yes, they are very, very important, very pertinent, but the support system required, the other inputs which are required, because yes, we are training postgraduates, we are bringing out doctors, and they should and they have to deserve the best quality care which is available. Having said that, I can see Kedar also. Some of his questions have been already answered, but Kedar being a great enthusiast of accreditation and quality program, I will request Kedar, your comments and your queries, please. Kedar, are you there?
Kedar is there.
Hello?
And thanks.
Okay.
Yeah, please. And thanks, Shashi. I think I see from Faridkot, Shashi is there and he has said, great, and I want Faridkot Medical College to do it.
Yeah, so I will request Komal to please allow Dr. Kedar for his comments.
Oh, Sushil. Yeah. Hi, Kedar.
Hello, Surender.
Yeah.
It was a wonderful talk about accreditation. I think you covered the entire journey and the current scenario. Excellent. So my few questions are actually interrelated, so I will ask them. So is there any mechanism for follow-up of accredited units, and are there any key performance indicators followed by accredited units? As well as, is there any collaborative work on NNF accredited units done? And lastly, how do you evaluate NNF accreditation program? Is there any mechanism?
So thanks, Kedar. Actually, this is all the suggestions we are getting, and we are actually doing all this brainstorming on this. So as I told sir also, Dr. Rajesh Khanna also, we are making this app, new website will have all this data set which will be there, and where we will be capturing these data set. And as far as collaborative is concerned, for the fellowship program, we have the collaboratives where we are teaching them together. We are looking into their training part, imparting skills. All our new programs are aimed towards them. That is the collaborative we are there. Training, we have done a collaborative. Whereas data sharing is there, we have tried so that the units don't get threatened or they don't feel exposed by sharing all the data. We have only pertinent points which are some quality indicators. If they are not too sharp in quality indicators, probably some quality indicators are there which we are able to capture. So this is something which is just about to get finished also, and we will certainly roll that very soon. So this was about the collaborative you said and the data points for this.
Yeah,
and,
I mean collaborative in the sense, not necessarily those who are willingly participating centers. We can have.
So this is. So we actually
run across units, those who are actually agreeing to participate and display.
So for this we needed little funding because it requires a lot of backhand support, analytical support, because you can collect data, but who will analyze it? So that analytical support, that backhand collection data is required for this. I think this is there. This was there, yeah. And Dr. Bhashwati, Dr. Bhashwati has Sushil has asked some question. Dr. Bhashwati.
Yeah. So yeah, I think thank you, Dr. Surender. Wonderful answers, and Kedar, nice questions. We have already overshot our session by about 30 minutes. I know it's very interesting. Today we have been privileged to hear the quality improvement and accreditation journey, especially quality accreditation journey of NNF. Yeah.
Sushil, just because Dr.
Yeah.
Bhashwati Ghoshal is a prominent
Yeah.
leader in there in Kolkata.
Yeah.
Madam, we certainly want to do accreditation program
Okay.
in government. As far as NNF EB meeting was held required, we wanted to have different, whether for government and private, but you cannot just have punish private sectors all the time and charge them with some money and not charge with government sectors. But we certainly, if like UNICEF supported us in past, and we certainly want funders to support us for government-run units for accreditation, because it would require funds, and to generate those funds, government-run institutions will be difficult. So, like I went to KEM and Sion, Lokmanya Tilak Hospital in Sion, and there the unit head and the madams and the teachers were actually pooling money to get accreditation done. So they're from personal money, they are actually getting accreditation. You know, so in a government sector, people are using personal money to get the accreditation done. So this was very painful to actually go there and see that. And this is something which needs to be taken care of by the, if not by the state government, but yes, but some some agencies who want to improve the care in medical colleges should come forward and take care of the expenses for accreditation, which are genuine.
Thank you, Dr. Surender, for actually taking all the questions. I know the session has already been prolonged by 30 minutes, and whatever queries which will come to us, we will be forwarding you, Dr. Surender, if you allow us, so that they can be resolved. I know some people were also asking for the for the toolkit. I think they are available on the site and at the NNF site, maybe. Yeah. Yeah. The link has already been shared. A very interesting session, Dr. Surender. It has been a pleasure listening to the journey as well as very interesting pertinent observations, points. I'm pretty confident that today's session has been very useful for all of us, making us realize that quality improvement and accreditation is not a one-stop center. It's a continuous journey, requires a lot of insights, repeated reviews, repeated approaches, changing your tact, changing your approach, rebuilding yourself. But the good news is that, as usual, pediatricians and neonatologists have been the front runner.
Yeah,
for accreditation and quality stays like that. I thank Dr. Komal, Dr. Sonam, Dr. Rahul for facilitating this sessions today. And I also thank all the participants who have been there continuously for more than 1 hour for this interesting session. Dr. Ankur, thanks for your observations as always and witty remarks, which would also guide us and make us ponder about our approach and of rebuilding us. And with that, I thank you all. Have a good evening and see you on the next COP session. Thanks, everyone. Thank you, Dr.
Sushil. Komal, can I have the video, because there are pertinent questions directed and which will help us.
So the video will be uploaded on our YouTube channel. And also before ending, I would just like to make a small announcement. So NQOCN is organizing its second annual conference in the month of November. The theme of the conference is From Concepts to Reality, Bringing Innovations to Quality. The conference is on healthcare quality and patient safety. It's on 4th and 5th November and will be held in Bangalore. This is the QR code for accessing the website, and the link is also there in the chat section. So I request all the participants to please go to the website and register yourself for the session. Thank you so much.
Thank you, Komal, for reminding me. Yes, it is going to be a wonderful session. We are calling the best of the best in quality improvement and accreditation program from around the world. And we love to see you all there. Don't miss this opportunity. And we hope to see you all in Bangalore on this Quality Improvement International Conference by NQOCN. With that, thank you everyone again and have a good day.